In 2008, I was asked by the Royal College of Physicians would I chair a group to help develop a national early warning score to detect acute illness in the NHS. And the reason why we were keen to do that is that there were a number of early warning scores being used, and we wanted to standardise it across the whole NHS so that we're all using the same system, so that when we hear a score, we know what it means. So NEWS is really simple. It's based on basic physiology using measurements that we routinely measure in hospital. Temperature, pulse rate, respiratory rate, blood pressure, conscious level, and oxygen saturations. And we know that when somebody becomes unwell or is beginning to become unwell, those parameters can change quite subtly at times. But when you aggregate the score, you get a much more powerful and sensitive measure of whether somebody is deteriorating from a clinical perspective and needs help. So we launched NEWS in 2012, and after 5 years of experience of use, we decided to update it in 2017. Now the update had 3 new features. Firstly, a new scoring system and scale for patients with hypercapnic respiratory failure. So these are the CO2 retainers, usually with COPD, and that was to facilitate safer oxygen prescribing. Secondly, we included new confusion as a score, because we know that when somebody is acutely unwell, if they become confused as part of that acute illness, that is often a very serious sign that they're going to deteriorate, and we need to act fast in most cases. And thirdly, all of our experience of using NEWS over the previous 5 years have told us that once the score is 5, there's a very high risk that that patient will deteriorate, often requiring ITU or even deteriorate to the point of death. So that's why 5 has been included as a key threshold to alert a senior team to come and review the patient if a patient is scoring at that level. Now the great news at UCLH is of course that we have EPIC, and EPIC automatically calculates the NEWS score for us, and I find that incredibly helpful when I'm down in A&E, when I'm on call. I can look down a list of a number of patients and see those scores all color-coded, so that it helps me prioritize which patients I need to see first in terms of clinical priority. So we're really excited about the fact that NEWS was developed by doctors at UCLH. NEWS has been deployed at UCLH, and we know that the continued use of this is going to allow us to continue to maintain our position as one of the safest hospitals for patients with acute illness in the NHS.
NEWS2 has 2 SpO2 scales, 1 and 2. Scale 2 is a dedicated SpO2 scoring system for patients with hypercapnic respiratory failure whose desired oxygen saturations are set at a lower level, 88 to 92%, with the scoring system adjusted accordingly. This should only be used in patients with confirmed hypercapnic respiratory failure on blood gas analysis, on either a prior or their current hospital admission. All other patients should be on scale 1. It is important to check patients are on the correct scale along their hospital journey, from when they attend the emergency department and move wards. Setting the correct SpO2 scale is easily completed within EPIC, and whether the patient is on a scale 1 or 2 is shown within each vital signs documentation.
The part of the NEWS2 scale that focuses on brain dysfunction is the ACVPU scale. That stands for alert, new confusion or delirium, the same thing, response to voice only, responsive to pain only, and unresponsive. And all of these, apart from the A, are a sign that the brain is dysfunctional. And all of them, apart from A, would score a 3. That means we're worried about any type of brain dysfunction that affects your alertness. We would spot things like acute confusion by how patients talk to you in terms of the history that they may give, how distractible or how inattentive they are. A patient with acute confusion or delirium would probably not be able to concentrate on tasks or repeat things like months of the year backwards or days of the week backwards, and you would find that they're very distractible and unable to follow the thread of a conversation that you might have. We're specifically focusing on on new confusion because that represents a brain's change from its normal baseline. People who have confusion as part of dementia, long-standing confusion, that is not part of an acute warning score. So it's important to understand to the degree in which confusion is new, i.e. delirium, and therefore commenting on people's concentration and attention as part of your handover to see if people have changed from their baseline is an important part of scoring this properly.
Sepsis, infection with organ dysfunction, is one of the most common causes of deterioration. Sepsis is life-threatening, but early identification and treatment can save lives. Common signs and symptoms of infection that we see at UCLH includes shortness of breath, productive cough, skin rash, pain on passing urine, recent foreign travel, among other symptoms. Recognizing and reporting these signs and symptoms can improve your patient's outcome. If your patient has suspected or confirmed infection with a NEWS score of 5 or above, or other indicators of illness, think sepsis and escalate urgently so treatment can be started promptly. Ongoing monitoring of your patient's vital signs and fluid balance is really important in these cases to ensure we recognize deterioration early.
On T14, we've got really have great links with the pharmacists to ensure that good stock of antibiotics and that strong communication with the doctors to know when antibiotics are prescribed so that we can start the treatment promptly.
Patients have a rich source of knowledge about their medical conditions which are often underutilised. Physiological changes can appear much later compared to subtle changes that only the patient or visitor might pick up on. If your patient's visitors are concerned or voicing they just don't feel things are right, listen to them, escalate their concerns and check their vital signs, and remember, low news doesn't necessarily mean low risk.
Give patients and their visitors a voice. It can be vital in early recognition of unwell patients and improving patient safety. You can use a communication tool, ISBAR, to structure your escalation by introducing yourself, discussing the situation, background, assessment, recommendations, and coming to an agreed decision to get the best outcomes for your patients.
On T12 South, which is the adolescent unit, we work really closely with parents and caregivers and the patients themselves. Often if there is a change in the young person, the parents will be the first people to let us know, raise their concerns. It may be something as simple as going off their food, being in pain, or just a bit of a change in behaviour that we may not have noticed. So they will obviously relate that back to us. We will then look at that information, reassess the young person, look at their vital signs. So they're really vital in letting us know when something is not going right so we can spot a deteriorating patient. Another thing that we have on the ward is a great multidisciplinary team like the OT and the physios who, when doing their input, will notice something and will let us know what their concerns are, and then we can look at that, look at the patient's vital sign, reassess, and then make sure that the patient is stable.
So we hope you found this video useful. We really do want our staff at UCLH to embrace NEWS because we know that this is going to improve patient safety even more. And if you have further questions or you're interested in learning more about NEWS, there's a lot of additional information on the UCLH intranet site, and of course we would encourage all of you to undertake the NEWS training module. I've done it myself. It took about 20 minutes. I actually passed, and we want UCLH to be at the top of the league table of compliers with training in NEWS. After all, we developed it here, and 250,000 NHS staff across the country have completed training, and so should you.